You are.
All right, good morning. This is Senate Health and Welfare, and it is Tuesday, January 20th. This morning, we're going to talk a little bit about solvency and what solvency means for insurance companies. So, Nolan, thank you for being here. I'll just turn it right over to you.
Great. For the record, Nolan Langwell, Joint Fiscal Office. You're going to be hearing a lot about insurance solvency today in Blue Cross Blue Shield. And I think I'm really here to sort of set the stage and talk a little bit about an issue brief that I did this summer, actually this fall, actually this winter, whenever. It was done recently that kind of flagged some concerns that happened around Blue Cross Blue Shield insolvency. And to kind of give you some background, I know that the Commissioner of Department of Financial Regulation will come in and talk about the Act 68 report, I believe, which is related to this. So I thought I would just maybe touch upon some of the highlights. So first of all, talk about what do we mean by solvency, why is it important, and maybe some of the highlights that came out of the issue brief, and encourage everybody to read the brief when they have the time, or they're home, or they're looking for something to read. Good nighttime reading. It's quick. So I'm going to start by sharing my screen. So, a little bit about Blue Cross Blue Shield. I don't know if you've had them come in yet or not. There it is. Thank you.
Not yet.
So Blue Cross Blue Shield of Vermont, they're our largest insurer in the state. They count a little more than half of the commercial health insurance market in Vermont. They're also the only health insurance company that's domiciled in Vermont. And they're actually specifically established in our state statute. So they're kind of unique in that way. So we'll start off by talking a little bit about, well, who regulates health insurance in Vermont. So you have the Department of Vermont Financial Regulations and the Green Mountain Care Board. The Green Mountain Care Board, really their focus is more on, and they have a whole list of what they look at, but essentially they look at the affordability, the rate review, basically ensuring that the rates are, sufficient and affordable, and they have a whole thing in their statutes of what they look at. Department of Financial Regulations, they regulate all the other insurance, auto, term life, et cetera, in Vermont, but not health insurance. They do to the extent that they look at solvency. And again, they weigh in on, are the rates adequate? Are there enough amount of money going into surplus to reserve? So that's their piece. And they submit, but they don't approve the rate. They submit. They weigh in by law. They're required to submit like a memo saying we reviewed the rates and we think that that they're too high or too low. So they weigh in, but the board ultimately is the one who decides all of the insurance units. So that's the difference between the two of them. The Commissioner of Financial Regulations will come in, talk more about it, because when we start talking about solvency, that is the realm, the jurisdiction of DFR. So when we talk about solvency, what does that mean? Essentially, it's a company's ability to meet its long-term financial obligations and to continue their operations. It's an indicator of a company's financial health. Can they pay their bills? And I just mentioned in Vermont, DFR is charged ensuring that they have the solvency to fulfill their financial obligations to the policyholders. And then I'm going to talk about a thing called risk-based capital, which is a tool that's used within the health insurance industry. It gauges their solvency and helps with reacting to the company's solvency and financial health. And there's actually, I'm going to get it. So it was created by the National Association of Insurance Commissioners after the banking crisis in the 80s and the early 90s. And basically, it's a tool that regulators use that takes preventive and corrective measures to intervene. Essentially, what they are is they're model legislation that I think pretty much every state has adopted in terms of different thresholds, and I'll get into that, of what it means and what happens when they hit these certain metrics. And to determine something solvent, you have to create metrics. So the NAIC create these metrics, and every state uses them. We tweak them a little bit, and Kai will talk about, I assume he'll talk about why RBC is important. But I think this is something that when I first did an issue brief on this 7, 8 years ago, people are like, what? RBC, what the heck is that? And I think it's a useful tool for legislators to understand what does that mean? And then once you understand it, you can see, oh, okay, that's how you measure that. Oh, they were in trouble or they're doing okay. It expresses a ratio. It's a complex formula. I'm not going to get into how it's determined, but more, I'm just going to talk about how it's used as a benchmark. As I mentioned, most states, including Vermont, have adopted these statutes. And DFR and Blue Cross Blue Shield Association also use RBC ratio within their policy benchmarks. And I'm going to talk a little about the Blue Cross Blue Shield Association, which is the ones who own the Blue Cross trademark, and then all of us Blue Cross Blue Shield of Omaha, Blue Cross Blue Shield of Massachusetts, and Vermont, they all are members of that association, and there's certain things they have to do to maintain their Blue Cross Blue Shield status within the association. Oops. So what this is that, as I said, there's ratios, and without getting into how that ratio was determined, what's more important is understanding what does that mean when they hit certain ratios, and the ratio is representative of their financial status or health based on this complex formula that everyone's agreed upon is a good measure of solvency. So if you look at the bottom piece is like what the NAIC says. And so basically, if you're 200 to 300% of RBC ratio, it means that a corrective plan may be required, and there's potential action, company level action. When you get to 150 to 200, then it's plan is required. And that would be the regulator going in and saying, okay, you need to start doing X, Y, and Z to get your solvency back up. If their RBC goes below 150 to 100 to 150, the regulator has the authority to intervene, which means DFR could jump in and take over, or they could continue with a corrective action. But when it gets below 100, or even less than 70, the DFR, the regulator, that they would be required to take over the insurer. And you'll see in a future slide why that's important and how that why it's important here. The ones above, so 590 to 745, that's a target range there was a memo by Oliver Wyman, that's an actuary that was hired by DFR in 2019 that said a healthy range for Blue Cross Blue Shield should be 590 to 745. At 375, this is the Blue Cross Blue Shield, so this is how they're using it. If you get to 375, then Blue Cross Blue Shield Association sends a warning, and they do what's called intensified monitoring. So the association, we're watching you, paying close attention. If the RBC goes below 200%, which is the minimum level, it's the minimum level that a Blue Cross Blue Shield affiliate must maintain to maintain their affiliation. If Blue Cross Blue Shield of Vermont goes below 200, they can lose their affiliation with Blue Cross Blue Shield. I'll talk about why is that important. So the charts above, and you can see this is the history of Blue Cross Blue Shield's RBC ratio. In 2020, they were 480. In 2021, they were 607. Then you can see there was a decline. In 2024, they were to 214. Now remember, if they go below 200%, they lose their association. This is why there's reason for concern, or there was reason for concern. I don't think I have this on the slide, but basically, last year, or maybe 22 years ago, when their financial situation was really low, they received, I believe it was a $30 million loan from Blue Cross Blue Shield of Michigan, which they're affiliated with. They've been affiliated with them for 2 years now. And according to DFR, if they had not received that loan, they would have been well below 214%. They would have potentially been that threshold where they could have lost their. Now, traditionally, RBCs are confidential. It's not public. This I was able to put out because it was in a public report released by DFR. And what I can also say is, after talking to Blue Cross Blue Shield, they're in a much better situation now. I don't know what their RBC is at the moment, and I'm not going to ask because that's confidential. We cannot ask them that. But they did take, when they received that infusion from Blue Cross of Michigan, it was a loan, and they are doing a point where they have actually paid off that loan, And they're doing significantly better at this point last year than they were the previous year. So they are doing much better, but there was definitely, while there was cause for concern, and there continued to be concern that you should pay close attention, the trend is looking positive, and Blue Cross, and I'll let them talk about it, they are feeling good about the direction we're moving in. So I don't want to scare you. I want to scare you that, wow, we came really close, but they're doing better now. And I'll get into why it's important, what happens if they lose their affiliation. So I think, I had a question first.
Have they done an analysis as to why they have turned their the ship around and why things are going well?
I would defer to them when we hear from them on why they're doing better.
Okay.
I can't weigh in on that.
Thanks.
And let me try to see. So I was highlighting all these pieces that are important to flag. Oh yeah, if they hadn't received that loan, they would have been at 104%. But on the up and up, and I should have prepped better. Another point that I want to make about their so yeah, November, they reported a $47 million gain for the first 9 months, and that was compared to a $29 million loss same period last year. So that was the point I was trying to make, is that their financial situation is better, but continued monitoring is warranted. Oh, it's right here. I had to look it up there. It was right on my slide. It's been like a week or two since I've given this presentation, and normally I would have time to look at it again, but I have a chance to. The other piece that this should help kind of make you feel good is that DFR continues to meet with Blue Cross Blue Shield frequently. There is a corrective action and plan. They're acting upon it. DFR is working with them, so it's not like it's not like nobody's doing anything. And Blue Cross Blue Shield is very active in that as well. But this is what I want to talk about too, is that if they went below 200%, they would be, it's very likely when they were at 214, when they were below 375, they were definitely, I'm sure they were being looked at very closely by Blue Cross Association. And again, if they went below 200, they can lose their. So this is something I really want to talk about, is if Blue Cross Blue Shield were to lose their Blue Cross affiliation license, the implications would be significant. I don't think people understand how significant it is. First of all, policyholders could lose access to the Blue Cross Blue Shield nationwide provider network. So suddenly you're out of state, you get hurt. Like right now, if you're a Blue Cross Blue Shield member, you go anywhere in the country and you're in network. So but they'd also lose significant technical assistance, legal assistance. They lose all the branding resources, basically critical shared data and valuable resources, right? All things to help keep them efficient and effective and be able to, respond to their clients promptly and to carry out their purpose and their goals. If they lost their affiliation, not only would they be in serious financial situations and they would lose all those supports, it would just threaten the existence of Blue Cross Blue Shield. And I think that people realize that if Blue Cross Blue Shield went out of business, the implications would be significant. It would be extremely disruptive for up to 200,000 policyholders. That's over, it's about a third of the state. And the ripple effect would be felt throughout the system. So you have, when you think about the market, you have individual, small group, large group, right? And then we also have our self-insured. So Blue Cross Blue Shield has about 200,000 people in the state. You have about more than half of those are self-insured. That's like the state. You have, small businesses, teachers, etc. If Blue Cross went out, it would be disruptive to, for instance, state employees, but they could just go get another third-party administrator to maintain it. If you're an individual, small group, or large group, let me back up. If Blue Cross Blue Shield went out of business, it is fair to speculate that an MVP would probably pull out as well. They're the only other insurer that's in small and individual group market. And the reason is because we're not a very big part of their business. And they they wouldn't want to assume the risk, because they would be taking on all of our negative risk. And so there's a very good chance they would pull out too. Assuming that happens, you would have an insurance desert for 70,000 people on the individual small group market who now have nowhere to buy insurance. If you're a small business and you want to offer insurance, you have nowhere to buy insurance because you can't buy, there'd be nobody left. There's no other insurance companies that offer those products in the state. You know, you
So
can't.
all those people would be uninsured.
Yeah, not only would be uninsured, they'd have nowhere to buy. You can't call them sick.
They would be uninsured and they would remain uninsured.
It would be an insurance desert. There'd be no place for them to buy insurance unless someone came in. Or unless there was, right now, people in Vermont cannot buy through the federal exchange. You have to change some legislation to be able to buy through it. But then you would lose a lot of that. It would look very different. We couldn't do subsidies for it because, you know, the reason we can do subsidies, state subsidies, you have the federal subsidies, and then we have our additional state subsidies. We couldn't do those additional state subsidies on the federal plan. We can do it to the state plan, we can't do it. So the point is that it would create an insurance desert. And then also it disrupts the system because when you have that many uninsured, you go from, you know, I think where we're at 15,000 uninsured in the state or 20, some low number to like suddenly we have like, you know, 75 to 100,000 uninsured in the state. Like that puts an incredible amount of pressure on the hospital system because people still need services. Primary care providers are still going to see their longtime clients and they're going to take a hit. Doctors and hospitals, they'll take those and they'll have bad debt and free care. And what happens? Those costs will be shifted onto the other payers and everyone else's health insurance would go up significantly. It would put an immense amount of pressure on our system to have that many uninsured people in the state.
Don't we currently have one of the lowest rates of uninsured?
We have one of the lowest rates of uninsured, but we have one of the highest rates of premiums.
Yeah.
Right?
Mhm.
And we are an aging state, just because we are always considered one of the healthiest states, but we also have high premiums, and we have an aging population. We have a lot of pressures on our system, and that's the same pressures that are driving up health insurance across the system. So, my point is that Blue Cross Blue Shield is one of those foundational pieces of our system that if it just went away suddenly out of nowhere and we had no plan to sort of offset that, it would be extremely disruptive. So I'm not trying to say that they're a super important thing, but my point is that they are an important part of the system that cannot be undervalued. Is what I'm thinking.
Right.
So that was the gist of my report, basically trying to lay out like why solvency important, why we use RBC, and how close to the brink Blue Cross Blue Shield came, and why we need to be concerned about that. You know, if there's no plan for Blue Cross Blue Shield were to go away, what would be planned, right? So
Things are looking better. But at their best, they were just over the red line. Have they ever been up to the green line or closer to the green line?
I don't know. When I did this report, I think at 27, the first time I did it, I looked at what other RBC, like I was able to find, there were some states where insurers and RBC in the thousands. I think part of the reason that it may not have been in Vermont, it may not get that way is because they're not gouging, right? They have been regulated and they do try to, you know, keep their administrative costs low. Like, you know, I'm not trying to like toot their horn, but they're not some of these insurance companies that have questionable practices, right? Because they're so heavily monitored or so heavily regulated.
Might also be because the Green Mountain Care Board's charge was to keep rates affordable.
But even before the Green Mountain Care Board really turned the screw when it first started, I don't think that they've ever been that. I mean, I don't know. I didn't look back that far. But now, yeah, with the Green Mountain Care Board, they wouldn't let it get that high because they monitor how much they're trying to keep things affordable. So they're not. Yeah,
when I started here, they were operating on a letter of credit.
Yeah.
And they've gone up since then. From another Blue Cross Blue Shield. And last year, was, I think, the first time I've ever been in trouble.
Yeah.
There was several reasons for that. I think we worked on a couple of them here last year.
I listened to an interview. Well, let me back up. A lot of people have said to me, well, why don't we allow more competition? There's an interview with Scott Beck where he talked about the big C. I think the problem, and I'm not trying to get political, I'm just trying to make the point. I'm trying to get to the point that we're not, if you're an insurance company looking to expand, we're not a place you want to look because our market is so small. That's the point I wanted to get to. We're trying to get to the competition piece. I mean, that's what I'm not trying to get political. I thought he raised a really good point. But my point was, I was trying to say, competition in the state is, if we had competition, it would work, but it won't work here. I don't think, because we don't have a lot of people. I would try to make, and I'm not trying to be political. I thought he made a really good point of what I'm trying to say. But competitions, yeah, no, I saw your reaction. I was trying to give him credit for making a really important point. But competition and he's right, if we had more competition, but because our market is so small, it's difficult to have competition outside of the two insurers that are just competing with each other. If you added a third one, then suddenly nobody has enough market and then they all would leave. You know, so that was the point I was trying to get to, not the political piece. Sorry, I didn't mean to.
Well, one of the advantages.
I was trying to make a point that competition is an important piece, but our market's so small that it's hard for us to be competitive. That's what I was trying to say.
We have a small enough risk pool as it is for one organization or maybe two. We don't have large enough risk pool to split it up. And the more we split it up, the higher the costs for premiums go. And we're seeing that. The competition is kind of what got the country to where it is now.
Yeah.
We don't have enough market share.
That's fine.
I was trying to make the point that we don't have enough market share to be a place that new insurance company would want to come in and do business. That's what I'm trying to get at. Sorry, I wasn't
I
trying to.
appreciate your point, and I appreciate you not trying to be political, but at the same time, it was a comment that didn't really make sense because of what you just said. So anyway, I'll just leave that. But
Sure.
what I was wanted to say before was, I really appreciate you shining a light on this, and I know I told you, the brief that you said was great.
Mhm.
I hope we take the next step of looking into how we got out of the precipice of insolvency, and so what mechanisms helped alleviate that, and then what do we need to do in the future to avoid going back there? Because shining a light is important, but
Yeah.
But we did it. I mean, some of what has happened
Yes.
as a result of legislation that we passed.
Correct.
It's very much based on the legislation that we passed. I see you're shaking your head.
and I'm sure that's true,
Yeah.
but were there also inner workings that happen in Blue Cross?
I think the pressures of understanding that some of their contracts were negotiated at a high cost to the company that was a huge realization, and that was part of our legislation to break those open, but then also our reference-based pricing and the caps on infusion drugs and some other things that we did, plus
PBMs.
yeah, we did PBMs. And then the investigation within UVM Health Network, all of those things sort of coalesced around Blue Cross and Blue Shield having an opportunity to evaluate its financial situation. And the Fremont Care Board to offer some regulatory assistance. And we'll continue to look at these issues in here. But a lot of it happened in this building last year, some of it in this committee, most of it in this committee.
Yes,
Some of it in a regular.
and then like a closer analysis would be great, but
Yeah, no, to know exactly what
Yeah.
happened. And I think
what levers?
Blue Cross and Blue Shield can help us understand that. So can DFR maybe.
Yeah, and they have
Yeah.
a lot of thoughts and things to say about, they can help answer those
Yeah,
questions a little bit better. Mine was really more to shine the light. they're gonna get into the weeds and can answer some of the questions. And they might even have a better question about the history as well to answer. All right. Any more questions? Read the brief. If you haven't.
It's a master class. The briefs.
The bottom line is if we have the highest
Do you
cost,
want to look at the issue brief at all? With us, it's true.
I think that
We have a little time, that's all I'm thinking.
I think that so my presentation really was hitting the highlights of the brief. So I don't think there's anything else I really want to have to say other than yeah, I think I hit the points that I really.
I do recall when I was sitting on finance committee, we did do an analysis of administrative costs for Blue Cross and Blue Shield, and I think there was some concerns there that apparently has changed, or can ask the new folks at Blue Cross and Blue Shield. Anyway. Okay, yeah, I remember your issue. It's good. Any questions for Nolan? So if you're gonna give it a kind of the 100,000-foot description, the risk-based capital helps the company cover costs when
Risk-based capital is a tool used by the industry, so regulators and the associations and the insurance company themselves to monitor and respond to solvency issues. So it's a combination of a metric, so that's the percentages that help sort of create the thresholds that you really, and then once you have those benchmarks, it's like, okay, here's a corrective action and tool and monitoring that should be done, that you can do or should do, to sort of try to right the ship with the goal of trying to save the company. And more importantly, save the policyholders. So it's a tool, and I know Kai will talk about it too. And I remember when I first wrote it, I was like, it's a tool that they use. And Kai came into human service healthcare, and they said, no, it's the tool. It's the most important tool. So,
okay. Thank you. We have some time before DFR comes in. I don't know if they're available before 11. I could reach out and see. I do have a couple things to talk about. Unless you all have questions for Nolan. Good. Okay. So all solving.
I hope you're all solved.
We are also. One of the things that we have on our in our webpage are all the reports that have come to us, and Ben and Katie put together that multi-page, it's 12 pages of reports. I printed myself out a copy, right, was to do it. And I'm gonna go through those reports and try to triage and figure out the ones that we can check off, eliminate, those that we may want to hold for a period of time. And I'm gonna ask you to do the same thing, just to look through. When I finish with the written piece, I'll share it with you and pass it around and look at it. Because I'm thinking, one of the things I've heard from the folks who are doing these reports is that's all they spend their time on, and that they don't have the time to actually do the work of the administration. So it's Department of Health or other DCF or whatever. There are some reports that are key. I'm not saying all that, but maybe some of the quarterly reports could be left aside. And if we need that information quarterly fashion, we can ask for it. And there are things in there that we can ask for rather than have them put together a written report all the time and send them in to us. But so that's something to think about. So I'll just leave it at that. I'll let you know I'm doing that. There is a timeline for this. The first timeline I saw was this Friday, but no, that's not the timeline, but, there will be a timeline for, as the House of Ops looks at their bill that has the reports in it. And the sooner we get those into, if we get it into House Gov Ops before they pass the bill, then it's done. Or we can get it in as the bill comes over here.
So
Just a heads up.
do you want us to do some homework and come in with our thoughts?
It would be great if you would do that. I know it's a lot in the middle of everything. But I don't know that we'll actually have time on Friday to do that because we're meeting. Well, we have Nolan coming in on global commitment on Friday, and then we have a joint meeting with transportation on transportation, healthcare transportation services. Might be able to plug in a little time there, but we'll put some time in perhaps next week. So that's it. So,